Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Ridge Community Health Center reporting for the week of October 18th, 2021. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Alameda County now has 117,073 cases. This is up about 2,000 from what I reported 2 weeks ago. And 1,374 Alameda County residents lost their lives to COVID-19. This is up about 25 from when I reported 2 weeks ago. Vaccinations are at almost 90% of those 12 and up with at least one dose, and 83.4% of those 12 and up being fully vaccinated. In terms of daily cases, those continue to come down. As you can see here, the purple line is the 14-day case rate. And what I wanted to point out here is the blue bars are daily deaths. And so you can see that even though the summer of 2021 spike was much higher in terms of cases, actually almost double at its peak, that the deaths are much lower. So you can see compared to that summer of 2020 that there are fewer deaths compared to cases than when we compare that to 2020. And that is principally, almost exclusively because of the vaccine, and those who have died are primarily in that unvaccinated category, and those that have been breakthroughs are primarily in the groups that are now being recommended for either additional doses or boosters. Our test positivity rate for the past 7 days is at 1.2%, so that is nice and low. We usually get concerned when it's getting over 5%. And when we look by zip code, and we don't really have an apples-to-apples comparison because we only have a 28-day positivity rate by zip code. But nonetheless, when we look at even the highest zip codes for the past 28 days, we are under 3% in all of them. So 3% is not insignificant. COVID is still in our environment, and of course it only takes one infected person to give it to you. So we should continue to exercise caution, but glad to see it coming down in our area. I wanted to point out a recent Kaiser Family Foundation analysis that showed that in September, just last month, COVID-19 was the second leading cause of death in the United States. So this is discouraging, to say the least, to be this far in to the pandemic and have a tool that is actually quite excellent in preventing death, the vaccine, and to still have COVID-19 as our second leading cause of death. And the same analysis estimates that from June 2021 to September 2021, that 90,000 deaths from COVID-19 could have been prevented with vaccines, and this is nationwide. So, and more than half of those preventable deaths occurred just in the month of September. So no question, we are still in it. We are glad things are coming down here in the Bay Area, but let's keep in mind that this is not the situation everywhere, which means that we're all still vulnerable. So now is a good time to be doing everything that we can to prepare for the likely fall or winter surge. By way of booster update, which is unfortunately becoming a recurring segment here and probably one of my least favorites because it continues to be generating confusion. And while there are multiple data sources being looked at, the timing of it all is really being initiated by the White House and by the pharmaceutical companies. So that's why we have guidelines currently only for Pfizer, and we're still awaiting some final recommendations on Moderna and J&J. So last week at the FDA's advisory committee, the VRBPAC voted unanimously, that's 19-0, that the available data support the safety and effectiveness of Moderna COVID-19 vaccine for EUA, the emergency use authorization, as a booster dose, and this is at half the regular dose, at least 6 months after completion of the primary series and this was the same groups as the Pfizer, so for individuals 65 and up. Also for those 18 to 64 at high risk of severe COVID-19, and also for those 18 through 64 who have frequent institutional or occupational exposure that puts them at risk of serious complications of COVID-19. And as we discussed with the Pfizer vaccine, the most debate is really in this last category. But I won't get into it too much today because we'll have more to talk about next week. Also, the J&J, they voted unanimously 19-0 that the available data support the safety and effectiveness of the Janssen vaccine under EUA as a booster dose in individuals 18 and up at least 2 months after the single dose primary vaccination, and this is irrespective of any conditions or exposure and things like that. So there was some discussion regarding mixing and matching, so using a different brand than the original brand, but there was no decision on that. There was some data that support that this may be more effective, especially when J&J was the primary series. There was also some discussion and what seemed to be the opinion of several of the committee members that the J&J probably really is a 2-dose series rather than the 1 dose that it was originally marketed as. But for now, we're waiting until this Thursday, October 21st, when the Advisory Committee for Immunization Practices will meet and make the recommendations on the Moderna and the J&J boosters, which the CDC may then adopt as is, or they can make some additional additions or modifications like they did with the Pfizer last time. So we will certainly be talking about this in more detail next week, and for now we are just sitting tight for Thursday to see whether the immunization schedule will be updated accordingly for Moderna and J&J. So today I wanted to get into a little bit of detail about COVID-19 testing because we have been getting questions about the at-home test, and so I wanted to go into a little detail. So first, just by way of a little overview, there are 2 main categories of COVID-19 tests. There's the diagnostic test and there are the antibody tests. I'm going to just put antibody tests to the side for the moment because antibody tests are at best an indicator of past infection, but the antibody test does not tell you if you have a current infection, and it actually doesn't exactly tell you whether or not you're immune to the coronavirus. So right now it has very limited use for the most part. But what I wanted to talk about in more detail today are the diagnostic tests. And those are the tests that we use to diagnose current COVID-19 infection. And there are 2 types of diagnostic tests. They are RT-PCR and antigen tests. And there has been a lot of debate about whether antigen testing is appropriate to use or not. We know that PCR is the gold standard, but the antigen testing tends to be quick. And so the debate is about whether we should or shouldn't be using antigen tests as part of our testing strategy. And I actually think that's not the question that we should be asking. The question is, when is it appropriate to use them or not, and when should we be using PCR or not? So proponents say that it gets us results quickly, and so we can therefore act more quickly to stop the spread. And those that are expressing reservations say that we can miss positives and we can also give a false sense of security and that they may not be used appropriately, and so they could end up doing more harm than good. And I think both of these are very reasonable and both are probably true to some extent. But I do think that at this point we need all the tools at our disposal because we continue to be in a real battle against COVID-19. And so we need to use what we've got, but we need to know how to best utilize the tools that we've got. So when you ask which one is better, the answer is complicated. It really depends on why you are getting the test in the first place. And so first, let me give a quick overview of each of the types of tests before we get into some details and scenarios. So the RT-PCR is reverse transcriptase polymerase chain reaction. It detects the virus's RNA using specialized equipment that basically amplifies the virus's RNA through a series of heating and cooling steps. And this amplification process gives us a very high degree of certainty about whether that specimen contains SARS-CoV-2 or not. So when the specimens are collected at the right time and they're collected properly, which they usually are because they're done by trained professionals, the accuracy of the RT-PCR gets us very close to 100% of whether there are viral particles in the specimen. The main problems are it can take a day or two to get results, so you need to make decisions about how you're going to conduct yourself in the meantime. Also, it stays positive beyond the infectious period. So in that sense, it's almost like it's too sensitive because it continues to be positive even when you're no longer contagious. The antigen test looks for proteins on the surface of the virus. It doesn't use any special equipment. It doesn't go through those amplification steps like the RT-PCR. So it's a lot easier, it's cheaper, it's faster, but it's also less accurate. Now, how accurate the antigen test is varies really widely based on a number of factors and which studies you look at. There are a lot of trials out there showing very different assessments of how accurate they are. They range anywhere from 50% to over 80% accurate, which is a huge range. So I think rather than going into details on the different trials and studies that have been done, it might be more helpful to explain the concept more generally and work through a couple scenarios. So first, we know that which antigen test you use, and there are dozens out there, and how good a job you do at collecting your specimen could affect the accuracy. Because PCR, it's collected by a trained professional, but with the antigen test, they can be done at home. So there's going to be some variability there. But let's assume you've got a reputable test and you're reasonably good at collecting your specimen. Then mostly how useful the test is going to be is going to depend on how likely you are to be positive. So I know this is a little bit confusing, but this is what we refer to as pre-test probability. So the likelihood that you are positive even before you go to take the test. So for example, let's say that you live somewhere with high COVID rates. So COVID is circulating around in your environment. So that could have been us a couple months ago, or maybe even in a few months, or other parts of the country or the world. So high COVID rates. And let's say you're not vaccinated, you've been out and about, maybe you've been exposed, you could have been, and now you've got symptoms, you can't smell anything. Well, we're thinking it's pretty likely that you have COVID because you have COVID symptoms, you've had a chance of exposure, and you live in an area where there's a high prevalence. So when your antigen test comes back positive, you should go with that positive. You should believe it. And in this kind of situation, sure enough, the antigen test is relatively accurate and can typically be relied upon. That's not to say you don't want to repeat it or get it confirmed, but you should behave as though you are positive. Go ahead and isolate yourself and take all of the precautions that we talk about around testing positive. Now, let's say you are in a setting of relatively low COVID transmission, like we're here right now in Alameda County at this time. You have no symptoms. Let's say you hung out unmasked the other day and you just want to be on the safe side, so you give yourself an antigen test. If you're negative, it's not super reassuring because the false negative rate in this situation of low COVID in the environment and no symptoms is much less than the prior scenario of high COVID circulation and symptoms. So you wouldn't want to use this negative test to make decisions. So let's say go visit Granny without a mask on. So you can either go ahead and get a PCR test at this point to confirm the negative, or you can actually improve the sensitivity of the antigen method by repeating the test 1 or 2 more times. So repeating the test every couple of days, and let's say all of them are negative, that will give you extra reassurance because now you've waited enough time. So in that same scenario, you hung out a few days ago, you take the test, you want to go see Granny, safest thing to do is wait a few more days, during which time you don't potentially expose yourself again in the meantime, And right before you go to visit her, you repeat the test. And another alternative way to do this would be to get that PCR test, which is going to be far more accurate in detecting any SARS-CoV-2 that is present. So again, because the antigen test is not amplifying the virus, it can only detect when the virus is already there in high numbers in the nose where you're taking the specimen from. And you're only going to have high numbers of the virus in your nose when typically this is going to happen when you have symptoms and when you're contagious. So in theory, this really is great, a test that can tell you when you're contagious. And it's true that the test is likely to be positive when you're most contagious, but it's also true that it can be negative also when you're contagious, especially if it's in the earlier days or the later days of your contagious period. So when you're getting that peak and you got a lot of COVID in the nose, you will likely be the most contagious and test positive. But you could be in those little bit earlier or later days of being contagious and you can get a false negative. And this would be a negative test when you are actually positive and contagious. So when you really need to get it right, you may want to opt for the most sensitive PCR test, especially if you can isolate in the meantime and you can take the necessary precautions. So saying this another way, the RT-PCR tells you if there are any viral particles, and the antigen test tells you if there are a lot of viral particles. And there's likely to be a lot of viral particles when you are most infectious. So it can be useful in helping you make decisions about your behavior, but it is not going to be the most reliable end-all be-all. So it's a great tool that can be used as an initial screening. And so adding rapid testing as a layer of protection, a layer that is quick and easy, it means that you could get yourself treatment sooner. It means you could keep yourself from spreading it sooner, which are very, very important both for your own individual self, but also in terms of containing this public health crisis. And when the antigen test is positive, believe it. You can get a PCR confirmation or you can repeat the antigen test, but whatever you do, treat it as a real positive until you've proven otherwise. But if it's negative, there's more you may need to do, like get a PCR confirmation or repeat the antigen test every couple of days. So currently, these antigen tests are available when you can find them on the shelf, over the counter at your pharmacy. Here's a screenshot from CBS that shows some typical tests which look and work similar to a home pregnancy test. And make sure that you distinguish this from the ones that you do at home, you collect at home, but then you mail them in. That's not what we're talking about here. The whole point and the whole big advantage of these home antigen tests is that you can get your results in 15 to 30 minutes. And as you can see, these are not cheap. 2 tests per pack, so you're really running between $10 and $15 each. And this can really add up, and it limits how much these can become a part of our actual strategy for disease containment if the prices are going to remain this high. Now, the good news is that the White House recently announced that it would spend $1 billion on rapid home COVID tests. This is apparently in addition to $2 billion that they recently spent to get them out into the community. We don't know whether this will be enough. Dr. Michael Minna, who's been a major proponent and advocate of more widespread use of antigen tests, said that this is going to amount to about 5 tests per person over the course of the year. So really that's not where we want it to be. There are countries that are making these available to every household for free, or you can buy them for $1, or you can call when you need one and it'll get delivered to you. And I really think that that is what we should be advocating for here in the United States as well. So hopefully these investments that are coming will make it so that every household can have these tests on hand. Hopefully this will happen in advance of a fall or wintertime surge. And I think at a minimum, every unvaccinated person should definitely have these at home. And everyone, vaccinated or not, should consider having these on hand if you have vulnerable or unvaccinated people that you visit without a mask on. And the way to use the test in those circumstances, so you're going to go visit auntie at the skilled nursing facility, or you're traveling to visit your elder parents at their home, then you are going to wait to do the antigen test right before the visit. So in the ideal world, you've done a PCR 3 days ahead of time, you've isolated yourself. I think we're all familiar with those guidelines. On top of that, you can do this antigen test right before your visit, like an hour before, because that gives you an indication again of how much virus is in your nose at that moment, and therefore how likely you are to be contagious. And I think everyone should have these on hand to use if you come down with symptoms. It may not be the only test that you do, but it would ideally be the first test that you do, quick and convenient before you even leave the house, as kind of an initial layer of protection and of information. You may still need a confirmation or a repeat, but it is a very good place to start. Whether you are vaccinated or not, we want you to avoid spread of COVID-19, because we know that you still can get it and spread it if you're vaccinated. Much lower chances of this happening than unvaccinated, but nonetheless, for everybody, whether you're vaccinated or not, in order to avoid the spread and reduce the impact of COVID-19, if you have symptoms, get tested immediately and avoid gatherings in the meantime. If you believe you are exposed, get tested in 3 to 5 days. And if you are positive, inquire about monoclonal antibody treatment. It is life-saving and can prevent you from getting sick enough to go to the hospital if it's started in time. Ask your contacts to get tested and isolate as well. Also, whether or not you're vaccinated, maintain optimum health. Quit smoking. Reduce alcohol intake. Eat a healthy, balanced diet. Consider a multivitamin supplement and additional vitamin D supplementation. Manage your stress and get a good night's sleep. Now, if you are not vaccinated, and this is very important, if you are not vaccinated, based on the contagiousness of Delta, if you have not caught COVID-19 before and you are not vaccinated, you do not have antibodies to COVID-19, and the likelihood, most experts agree, is that you will eventually catch COVID. So to delay catching COVID, and that is pretty much all you can really do is delay it, wear a high filtration mask when you know you're going to be exposed to others, avoid crowded, poorly ventilated spaces, and avoid traveling and avoid gathering as well, so that you can not contract or then spread COVID-19. Also, we want you to reduce your risk of severe illness and death. Obtain a pulse oximeter. You can also buy these at the pharmacy over the counter. Establish your baseline. What is your oxygen like when you're well? So that when you catch COVID-19, you can continue to monitor it. And if your oxygen saturation levels drop, then you know that that is one of the indications to seek medical attention. Get tested right away after symptoms start or after you are exposed, and move quickly to get monoclonal antibody treatment if you are eligible. And let's always remember the basics. For safer choices, outdoors is safer than indoors, further away is safer than close together, and a shorter duration of time with others is safer than a longer duration of time. This concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.